So in today's video, I'm going to go over the Plan G and Plan N and compare them to each other and a Medicare Advantage plan. My name is Brian Monahan. I've been working with people on Medicare or going on to Medicare for the past 20 years. And in my videos, I like to show you charts and actual numbers so that you can compare the plans for yourself. So as you see on the screen here, we have a Medicare Advantage plan up top, and we have Medicare or Medigap, Plan G, and Plan N. Now, I'm going to go back to this chart. The first thing I want to show you, if you're turning 65 or you're going on Medicare for the first time, my phone number is on the screen. You can give me a call. Also, I want to show you this chart. And this is going to show you what you need to do first. And basically, you're going to call your local Social Security office to sign up for Medicare. You're going to do that or do it online yourself, but I would advise calling them. And then also, if you're taking early distribution of Social Security, especially if it's a year in advance, you're 63 years old and you took Social Security, they're going to send you your Medicare Part A and B card in the mail, most likely. So you won't have to sign up. But if you do have to sign up, the first thing that you're going to do, if you look on the screen, is sign up for Part A and B. Basically, they give you Part A when you turn 65, but it's Part B that you're going to sign up for, even if you worked past the age of 65 and you did not go on Part B. Then you're going to choose whether you want a Medicare Advantage plan or if you want a Medigap plan, also known as a MedSup or a Gap plan. And as you can see on the screen, one side, Medicare Advantage, is in blue. Once you choose a Medicare Advantage, that's an MAPD. That comes with Medicare Advantage prescription drugs. So it comes with your drug plan, comes most likely with vision, dental, and hearing, and of course your medical. And it also comes with some other perks. Now, when you go the MedSup route, you keep your original Medicare card. You'll always keep that, but that will be attached to it. That's why it's called a supplement plan. And you will have to get a separate drug plan and a separate vision, dental, and hearing. So let's jump back over to the other chart that I have, and I'll give you the numbers. So in this chart, the first column, well, actually, the first thing that I want to show you is how much you're actually going to pay for Medicare. Now, the average person, the reason why I say that is if you're a higher income earner or a low income earner, this is not going to pertain to you. But the average person is going to pay $206.50 a month for their Medicare Part B. But it's basically for the card that you see on the screen, the red, white, and blue card. That's going to cost you each month $206.50. You're going to pay that no matter what, meaning whether you're on a Medicare Advantage or whether you're on a Plan G or Plan N, it doesn't matter. That goes to the government. So it either comes out of your Social Security check or they're going to bill you for it, and you're going to have to pay for that. Now, if you look at the screen, the first column is the premium. And as you can see, Medicare Advantage has a zero premium. And the other plans, Plan G is $165 and Plan N is $120. Now these are averages. Keep in mind, I'm licensed in 48 states. I have clients in all 48 of those states, and it's different in different zip codes. For instance, I'm from the Philadelphia area. The prices are going to be much different 2 hours away into the suburbs in a different county or a different zip code than in the city of Philadelphia. You could be 5 miles away from somebody and have a different price. So there's thousands of zip codes throughout the entire country. I tried to put together an average. So these are going to be the average prices. Let's start with the Medicare Advantage plans, because if you want to knock these out and you do not want a Medicare Advantage plan, I want to get this over with and explain to you how they work, because a lot of people either love them or hate them. And if you hate them, I'll go over this real fast. We'll get rid of that. Then we'll go over the differences with Plan G and Plan N and the drug plans. and vision, dental, and hearing. So let's start with Medicare Advantage. All right, so a lot of these plans are zero premium plans. The government subsidizes Medicare Advantage plans. It's around $1,000 per person per month. And so when you see prices going up, when you see more perks being handed out or perks being taken away, this is because the government subsidies are moving up and down, or some changes are happening. But for this year, most of the premiums, a lot of them are zero premiums. Now, the thing about that is the hospital stay, on average, it's $390 a day if you're in the hospital. Your plan could be $500, it could be $200 a day. There's going to be differences. You have to look at each Medicare Advantage plan. It doesn't matter what company. You could have a United Healthcare. They have maybe 6 Advantage plans. You have to look at the different ones. But for the hospital stay, as you can see, it's going to cost you. So up front is going to be minimal, but as you go, you're going to pay. Now, if we move over to doctor and specialist, for this year, 2026, now keep in mind, if this is 2027 or 2028, all you have to do is just adjust these numbers a little bit. So this video is still worth watching. But the doctor and the specialist are going to be, for the most part that I've seen, possibly zero going to your primary care physician, but then your specialist on average that I saw is $45. Could be $55, it could be $25, depending on your plan. Now, let's scroll down a little bit. CAT scans on a Medicare Advantage plan. Keep in mind, I said every time you do something, you're going to pay, most likely. So it's zero up front, but then you're going to pay in the back or as you go. CAT scans could cost you an MRI is $500. I saw that as an average. Now here's the big kicker about Medicare Advantage. And when you call my company, you're going to realize that we do not sell Medicare Advantage plans. We basically just work with Plan G and Plan N, sometimes the high deductible G. But and the reason there's a couple big reasons. Skilled nursing is one of them. So on Medicare Advantage plans, they only have to give you 20 days of skilled nursing. Now, I'll get into the Plan G and Plan N. They give you 100 days of skilled nursing. So if somebody has a stroke or something like that, they have to be in skilled nursing for a long time. You're not going to want a Medicare Advantage plan. Ambulance. Now, the ambulance rides could be $250. It could be more, but that's what I saw for most of these plans is $250. Let me scroll down just a little bit more. Now, if you look at this column, MOOP, that's maximum out-of-pocket for the year. Now, Medicare sets its standards for the Medicare Advantage plans, and the top that they can charge you, the maximum out-of-pocket, is $9,250. Now, most people would say, whoa, that's a lot of money. From what I've seen, even the most extreme cases are usually about half of that. So people will pay $4,500 or something like that out of pocket. But as we have seen and heard before, and I'm sure some of you have heard, a lot of these claims are denied. And so people go and they think, well, my doctor's in network and I'm getting something done that's medically necessary. And the companies will deny the claim. And you have to fight with the company. And a lot of times you'll have your doctor write a letter and so forth. I have over 1,000 clients. My office has tons of clients. I know people that have thousands and thousands of clients throughout the country, other brokers. They don't see this with the Plan G or Plan N. They don't see a lot of denials because once Medicare says that you can do it, the Plan G and the Plan N have to follow it. Moving on to the drug plans. So a drug plan is included with the Medicare Advantage, and usually zero premium, and it might even have a zero deductible or whatever it may be. Drug plans are usually pretty good. They're about the same as what you would find on Medicare.gov. And once again, when it comes to the drug plans, when I'm talking about Plan G and Plan N, I'm going to show you the website medicare.gov, and I have videos on this, so you can go into my homepage or my YouTube page and see the videos. But you're going to find your drug plans on this Find Health and Drug Plans on medicare.gov. But I'll go into that a little bit later. So 0 for the drug plan. So far, if you get a Medicare Advantage plan and you do absolutely nothing, you could pay nothing. This could be for a PPO or an HMO. Dental, vision, and hearing is included. And they do give you an over-the-counter card most of the time, where you go to CVS or Walgreens or wherever it may be, and you get your free toothpaste. They'll give you a booklet that you get all the freebies. There's a lot, cough drops and Claritin and all these things. You'll have a booklet with it. Another thing that they'll give you a lot of times is a gym membership. And this entices people to go into Medicare Advantage. The problem that I always tell people is, this is health insurance. This is not freebie insurance. And there are no freebies. So, in my opinion, of course, what the Medicare Advantage companies do, and this is all of them. This is AARP, this is Aetna, this is Humana, whatever it may be. For the Medicare Advantage, all of these companies also have a Medigap plan. So it's very different. It's orange and apples. But for the Medicare Advantage plans, they will try to give out the most freebies and try to get the most clients so they can get the most subsidies. And then a lot of them will deny claims. And, you'll have a nightmare on your hand. You might go to skilled nursing and think to yourself, oh my gosh, they're going to wheel me out of here in 20 days, or my loved one. And it happens. I've seen it happen. And then what happens is people try to get on a Medicare supplement plan and they can't. So it's very serious. So I wanted to go through that real fast, and hopefully I did. Now we're going to get on to my favorite plans, Plan G and Plan N. Now, between the two of these, I have probably about 50-50 clients now. It's more Plan G, but that's because a lot of people get on the Plan G, especially if when they're turning 65, they want what is the best plan or what doesn't have any copays. But it's about 50-50. And I always tell people, my clients, 95% are on these two plans, tons of different companies. Could be Aetna, could be Cigna, could be Humana, AARP. I generally only work with 5 different companies. But I try to get people the lowest price possible. And it doesn't matter what company you're with, is, in my opinion, as long as it's a blue chip company. I don't go with any no-namers because they always raise the price later on. But Plan G and Plan N, none of my clients are like, this is the worst thing that ever happened to me. You put me on a Plan N and it ruined my life. Medicare Advantage, I've heard that, not towards me, but towards other people. When people call, they say, I had an agent, he put me on a Medicare Advantage, I got scammed. That never happens with a Plan G or Plan N. So let's go to the premiums. So let's take Plan G. On an average, the premium is going to be $165 per month. Now keep in mind, like I said before, and I'm going to show you the math on this when I go down, when I scroll down. Let me just do that now so you kind of see it. So as you can see, I'm going to show you the math to the Plan G and the Plan N, but I'll get to that. So bear with me. Now, if we look at hospital, you're not going to pay anything for staying in the hospital or having a surgery in the hospital for Plan N or Plan G. Now, I have said this in many videos. I'm at the point now, in my 50s, I have parents, I have aunts and uncles, I have, friends, parents, and so forth that are my clients, and also my clients, where I've seen they've had heart attacks, strokes, cancer, you name it. I've probably seen most of it, 90% of the diseases and things out there. And in the hospital, they've paid nothing. So I've seen it firsthand. Doctors and specialists. Now, for both Plan G and Plan N, in 2026, there's going to be a $288 a year deductible. That's a Part B deductible. So most people, when they get a Plan G, basically you're only going to pay $288 for your medical for the year. And it usually hits right in the beginning when you go to the doctor's office or when you go to an outpatient center. You'll get that first bill and say, well, I thought I was paying nothing. Yeah, you're paying $288 for the entire year. And I'll show you that they're going to cover everything besides that. So as we're going along with Plan G, I'll get to Plan N next. Let's scroll down a little bit. So a CAT scan or MRI for Plan G is going to be $0. Skilled nursing, you're going to get 100 days at $0. Ambulance, as you can see, $0. It's going to cost you. The maximum out of pocket, I put down here $2,268. If you're paying that premium, I will get to that, how I worked out those numbers. Sorry. Let's scroll down. Now, the difference between the Advantage plan and the Plan G, Plan N is Plan G and Plan N do not give you a drug plan. You'll have to get one, and we would help you with that on Medicare.gov. And most of my clients are paying for their drug plan between $0 and $10 a month. And even if there's a high deductible that doesn't go along with generics, I have a video all about that. So that's not something you tack on $0 to $10 for a drug plan. That should be fine. You'll pay copays, but that's what the premium will be. Dental, vision, and hearing does not come with Plan G or Plan N. I always tell people it's going to be around $40 or $50 a month. And I'll add that in. You'll see on the math. You do not get any of these little perks, over-the-counter cards, and a gym membership is about a 50-50. Some companies might give you one, maybe they don't. We have to go over that with people that call our office. So let's slide back down here. I'm going to go into Plan N. Then I'm going to show you the math on both of these plans so that you can make a decision on which plan you think is best for you. Once again, no matter what, you're going to pay $206.50 a month to the government. That doesn't matter if you're on Medicare Advantage, Plan G, or Plan N. That's going to the government. So you can add that in. But on average, a Plan N, the premium, these come with different companies, Aetna, AARP, and I'm going to show you real quick. So on what I do is basically I have a site that is for brokers. You can't go there. Some people ask me, well, how do I get to that site so I can look at the numbers? You can't. It's for people like myself. But we look at the numbers and the different companies, as you can see on the screen. And there's a ton of different companies. There's AARP, there's Humana. And I put in a random zip code. But this is how I see what the best companies are. Then I go directly to the site for that company to sign people up. And just keep in mind, it doesn't cost you any more to go or less to go directly to the company. We have the same exact prices by law that the company has. So if Humana charges $150 a month for their Plan G in your area, it's going to be $150 a month going with us. And people always ask, well, how do you get paid? I don't get offended by that question. We get paid through the companies. They want us to send them, but in my company, we tried to get you the least expensive plan with those top 5 companies. Anyhow, so hospitalization with Plan N, $0 premium. Doctor and specialist, this is where Plan N differs for the most part. There's 3 differences with Plan N to Plan G. Remember, Plan G, you only pay that $288, and then the rest of your medical is covered. With Plan N, the 3 differences are you have a copay when you go to the doctor or specialist. You have a copay when you go to the emergency room, small copay, and then you also could have an excess charge for doctors that do not accept Medicare, which is actually less than 2% of the doctors in the country. I always say 3% to keep myself covered, but it's so small. I've never had anyone have that. But with Plan N, you're going to pay $288 as the deductible, just like Plan G. Then you're going to pay up to $20 when you go to a doctor or specialist. Now, I've seen both ways. I always tell my clients, email me, tell me how it's going. Let's stay in conversation. I've had clients email me and say, I haven't been charged a copay. I've gone to specialists, doctors, nothing. Is this okay? And I always tell them, yes, it's optional. Then I've had other clients say, I've been charged every time, $20 every time I go to the doctor. So it differs, what doctors do. Moving along, let's scroll down. CAT scans and MRIs are both zero for Plan N. Keep in mind those three differences. It's just the copays. Skilled nursing, you still get 100 days of skilled nursing, just like G. An ambulance ride is zero, will cost you zero. And I have the maximum out of pocket as a little bit lower, and I'll show you the math down low. It's the same thing with Plan G and Plan N for drug plan, dental, vision, and hearing. It's separate, so it's going to cost you around the same thing. Actually, it's the exact same thing. It's not. There's not going to differ because you're getting a separate plan. All right, so let's scroll down and look at some math. So we'll take Plan G first. Pretty simple. I have premium, deductible, and copays. So if you take the Plan G, like I said, on average, it's $165 a month. Multiply that by 12. Now, keep in mind, I did not include what you pay the government, the $206.50, just the Plan G. You multiply that by 12, and you get $1,980. That's what you're going to pay for the year. Then you add the $288 because that's your deductible. Most likely you're going to pay that. And your maximum out of pocket for Plan G, if you're paying $165 a month, is going to be $2,268. Now, this is for the best coverage in the entire country. You can go to the top hospitals, the top doctors, anywhere that they accept Medicare, this is going to be accepted. And both my parents are on a Plan G. I have a lot of family members either on Plan G or Plan N. Those are the two plans that I have. Everyone that I care about and want the best for, I give them that. Now, I always tell people I am from Philadelphia, and there is a Medicare Advantage plan there that I have a lot of clients on. I'm not going to talk about it here, but that's the only place that I have people on Medicare Advantage. If you call me and you're from any other state than Pennsylvania and you want Medicare Advantage, I usually just give you to another agent that I work with. I don't deal with them. Let's scroll up. And if you look at the maximum out of pocket here, you'll see that Medicare Advantage, they can charge you a lot. So when you look at it, well, I'm paying zero premium, but now I'm going to the doctor. Now I have to have MRIs. Now, some people love these plans. They don't go to the doctors a lot. They don't see. But when it really boils down to it, if money wasn't an issue or you wanted the best, you would get this Plan G or Plan N. And you'd pay that $2,300 out of pocket per year. And like I said, I have clients that have had major things happen and they love these plans, and it's on multiple different companies. So let's go to Plan N. Okay. So Plan N. Once again, you're going to pay that $206.50 to the government, so you'll have to add that in. I'm not going to do that to keep it simple. But for your Plan N, your average premium will be $120. You multiply that by 12, you get $1,440 is what you're going to pay the company for the year. You add on that $288, that deductible, and it brings you to $1,728. Now, I put in here that you go to the doctor 6 times. If you went to the doctor 6 times, they actually charge you the full amount, which most likely wouldn't happen. But worst case scenario. So if you think you're going to go to the doctors 12 times, just put that in there. You don't have to. You can go to the doctors 100 times. It doesn't matter. But most people don't. Especially when they're 65, they might go once a month or twice a month or whatever. So I put in once a month. That's going to bring you up to $1,848 for the year. Now, let's just say you went to one ER visit. $1,848 plus that $50 is what it's going to cost you to go to the ER. Unless you're admitted into the hospital, then it's waived. Remember those three differences of Plan N from G. The $20 copay for the doctor, up to $20 for specialists and doctors, $50 copay for emergency room, and this excess charge, which I'll get into. So let's scroll back up here. Just want to reiterate, when you look across here, everything is pretty much at zero when it comes to Plan G and Plan N. You pay your premium and you get to do what you want. But if you look at the maximum out of pockets, I have N in here as a little bit less. Now, if you go to the doctors or you go to an outpatient center or specialist, whatever it may be, it could be more. I have people that say, well, I should have got a Plan G. I go to the doctors a lot. But keep in mind, this is not a decision where most of my clients are like, oh my gosh, I really screwed myself. Because most of the time it's just a $20 copay going to the doctor. So even if you went, 4 times a month, you're probably going to equal out to the Plan G, what you're going to pay for the Plan G. So it's not a big mistake. Now, if you go 4 times a week, you're probably going to be upset and say, this is ridiculous. But most of the time, that's when you're really sick and you have great coverage. So the $20 copay might not even mean anything to you. But this is why a lot of my clients, when they call me for the first time, they say, I want a Plan G. It's because I want to pay this and I don't want to deal with anything. The premiums do go up around 5%, 5 to 6% a year. Sometimes it's more. Now, the word on the street has been that Plan N doesn't go up as quickly as Plan G. In 2025, that was proven wrong. I say this from personal experience. To those other agents on YouTube or wherever they are that still say that, that's their story. But from my clients and from what I've seen, because we look at the increases and we switch people and here's another company that's cheaper. We usually do that every 2 years, but we look at the prices. I've had people that have contacted me and said, my Plan N has gone up by 16% in 1 year. That it's been debunked in my mind that Plan N doesn't go up as much as Plan G. People say Plan G because it's a guaranteed issue. That could be true. But I've seen they both kind of go up. What I always tell people, if you're going to make a decision on either one of these plans, I would make it off the fact of, do you want copays or not? And you can always start with one and switch to another. People get scared of underwriting. I always tell people there's 12 major questions when it comes to underwriting. And that would be, let's say in the last 5 years, have you had a stroke, a heart attack? Do you have any major organs that are, your kidneys are bad? Your lung, you have cancer in the last 5 years. A lot of my clients think because they have high blood pressure or cholesterol problems, they're on a atorvastatin or something, that they're not going to be able to switch plans. It's really, if you think about it, it's the insurance company looking and saying, are we going to pay a lot of money for this person because we don't want to accept them? Now, when you're turning 65 or going on Medicare for the first time, you can be accepted into any plan that you want. Some states have a birthday rule where around your birthday, you can switch to a plan. If you're on a G, you can go from a G to a G, or you can go to a lower plan like an N, but you can't go up. Some states have that. Some states like New York have a complete guaranteed issue where you can do whatever you want, switch to any plan that you want, Plan G, Plan N, whatever it is. Problem is with states like New York, it's the highest price state. So this $165, if you're calling from New York, is going to be $400, $300 and something. It's going to blow your mind, the prices. So guaranteed issue is not always good. It's good for the sick, but it's not good for the people that are healthy because the premiums just shoot up. So let me just scroll down here. This is a little bit old, but this is states that do not have an excess charge. I think there's more that are added on to this. But the one thing I can say for an excess charge, this is the third piece of Plan N. I have never seen any one of my clients on Plan N get an excess charge. I get comments. Look in the comments below here. I really don't get any comments that say I got an excess charge. It's less than 3% of the doctors in the entire country. And out of that, half of those are in the psychiatric. So psychiatrists will charge you because Medicare doesn't pay them or reimburse them, whatever, pay them according to them enough. So a psychiatrist might charge $300 an hour for a regular person, or meaning someone who's not on Medicare. But then Medicare only gives them $60 or something like that. I don't know what the exact price is, but they charge an excess because they want to charge you more. But other than that, I have not heard regular doctors, and this is a Part B excess charge. So people always ask me about the hospital. Hospital is Part A. So it's different. You're not going to be charged an excess charge for that. So I hope this video helped. I'm going to be doing more videos like this in the future. And keep in mind, like I said, if you have any questions, my phone number is on the screen, especially if you're turning 65 or if you worked past 65 and you're going on Medicare for the first time. Give us a call. I'm sure we can help you. I'll see you at the next video.